The assessment of the inguinofemoral lymph nodes is based on the examination of an area called the femoral triangle. The region is defined by the long adductor muscle medially, sartorius muscle laterally, and the inguinal ligament cranially. The lateral space below the ligament is formed by the musculus lacuna with iliopsoas muscle and femoral nerve passing through it. The medial space below the ligament is formed by the vascular lacuna with the femoral vein medially and femoral artery laterally. In depth, the triangle is formed by the iliopectinea fossa, formed by pectineus muscle and iliopsoas muscle. We can demonstrate further anatomy. Medially, the gracilis muscle and the long adductor muscle. Moving laterally, we can describe sartorius muscle and outside the triangle, the rectus femoris muscle, the vastus lateralis muscle, and the tensor fasciae latae muscle. When assessing the femoral triangle apex on the ultrasound, we should recognize dorsally the femoral vein and ventrally the femoral artery. The femoral vein runs then medially to the femoral artery into the vascular lacuna of the inguinal canal. When we continue underneath the inguinal ligament, we can follow the common femoral vessels continuing as external iliac vein and external iliac artery. No debranching of the inferior epigastric vein together with the inferior epigastric artery. Going cranially, we see the junction with the deep circumflex iliac vein and artery. Firstly, we will focus on the femoral vein. In the depth, the femoral vein is joined by the deep femoral vein, continuing together as a common femoral vein, and more cranially and superficially, this is joined by the great saphenous vein at the saphenous femoral junction. At this level, a few centimeters under the inguinal ligament and after perforating the connective tissue of the cribriform lamina, the great saphenous vein drains to the common femoral vein accompanied with some slight anatomical variants by the external pudendal vein, the circumflex ileum vein, and the superficial epigastric vein. Now let's move on to the femoral artery. Examining it at the distal end of the triangle, we see that the femoral artery moves from a ventral to a lateral position to the femoral vein, where it is joined by the deep femoral artery, which together then enter the vascular lacuna as common femoral artery. It is very important to note that the bifurcation of the common femoral artery is approximately at the same level as the saphenofemoral junction, while the junction of deep femoral vein to the femoral vein is located distally. In the next step, we assess lymph nodes. We start with superficial lymph nodes lying above the cribriform lamina. They form a vertical strand going along the great saphenous vein and horizontal lymphatic strand lying perpendicular at the level of saphenofemoral junction, running along the circumflex ileum vein and extern pudendal vein. Now we will focus on the deep lymph nodes, which are located medially from the common femoral vein above the level of saphenofemoral junction, or more precisely, above the lower margin of the saphenous opening. It is also called fossa ovalis. Cranially, the lymph nodes extend to the inguinal ligament, where the uppermost node is called the Rosenmüller or the Clockett's node.